Good morning. I first came to the Adolescent Health Center about 6 years ago for transgender health care. For context, I'm now 23, and I'm a gay, polyamorous, non-binary survivor of sexual assault, domestic abuse, and conversion therapy. I'm also currently 5 years sober. To me, the most extraordinary thing about the Mount Sinai Adolescent Health Center is just how ordinary every visit is. Outside of the Adolescent Health Center, my gender identity alone tends to get a range of reactions from providers, from pity, shock, a million questions about how does sex work, apparently necessary to treat my ear infection. One of the main reasons I go to the Adolescent Health Center is nobody has ever made me feel like I'm a victim or a medical oddity. I'm just a normal patient. Likewise, because of my identities and experiences, many providers don't know how to respond to me. They don't know how to assess my HIV risk, or before my hysterectomy, why I keep asking them about quote-unquote female birth control. I quickly learned that if I didn't go on PubMed and look up how my care might differ and understand it well enough to explain it to my doctor, I might end up with inadequate or inappropriate care. In contrast, my primary care provider and endocrinologist at the Mount Sinai Adolescent Health Center, Dr. John Stever, is at the table over there. He was the first health care provider I've ever met who was able to educate me about transgender care. I'm not sure where I'd be today if I hadn't been referred to the Mount Sinai Adolescent Health Center, or if I'd even be here today. The first time I came out to a provider at age 12, he immediately attempted to change my gender identity and sexual orientation. After subsequently being denied care, prayed over, and called delusional while trying to get an annual physical, I decided there was no way I was going to seek health care of my own free will, even in emergencies. For example, a couple years back, I was sexually assaulted. I was in pain, bleeding, and unsure of how badly I was injured. And in that context, I decided there was absolutely no way I was going anywhere near a doctor. This may seem like a bit of a strange conclusion, but this was actually the second time I had been sexually assaulted. The previous time I had sought emergency care immediately and deeply regretted it. I thought about going to the Adolescent Health Center, and then I changed my mind. I couldn't accept the risk that the only primary care provider to treat me with dignity would come to look at me the way some of the emergency department doctors had. Fortunately, my psychiatrist told on me. I was absolutely livid at the time, but after coming in for treatment, I was relieved. What was really important to me at that appointment was less the physical care I received than the manner at which it was given. It was left up to me to share what I wanted, and after Dr. Stever explained the pros and cons of each course of action, I was left to make my own decision. There was no shock, pity, shame, just a quiet kind of empathy. And most importantly, it was all extraordinarily ordinary, which was exactly what I needed to face a world that otherwise had just stopped making sense. Being extraordinarily ordinary is absolutely priceless when the default setting for too many people like me is judgment and shame. My care at the Adolescent Health Center is what inspired me to pursue a career in healthcare. I'm currently applying for medical school and working at a congregate care setting for people living with HIV and AIDS. I want to do what the Mount Sinai Adolescent Health Center and Dr. Stever did for me, for everyone. I want anyone, no matter who they are, to have the opportunity to have an entirely mundane trip to the doctor. Thank you.